We're living today a really fascinating era when it comes to the advent of immune therapies in multiple myeloma. And these anti-BCMA-directed or targeted therapies, whether bispecific antibodies, whether CAR-T cells, whether antibody-drug conjugates, are really making a huge difference in the life of many patients. And they are providing life-saving options to patients who actually has no other option. So this is good news. The most complicated story in this field is how I'm going to sequence these different options. Because the target is the same, but the tool is different. And we know that it's not only about the sequence, but we have also to include, in my opinion, the patient preference. So for instance, CAR-T cells are used as a sort of a single-shot treatment. So definitely patients do prefer them. Obviously, they are not available everywhere. So you can see already one answer to the question, should I start first with CAR-T cell or bispecific? Well, if they are available, and if the patient can wait until you get your CAR-T cells ready, because we know that we may need a few weeks before your CAR-T cell product is available and ready to be infused. And sometimes you have an aggressive relapse refractory myeloma and you can't wait. So this is important. So from a, I would say, patient preference, it looks like giving CAR-T cells could be a preferred option. But beyond patient preference, based on the available data, and obviously this is, I would say, observational, because we don't have like prospective controlled data, it looks like that the efficacy of the bispecific, anti-BCMA bispecific after CAR-T cells, they work well. Whereas if you start with the bispecific antibodies, then it looks like the efficacy of CAR-T cells is a little bit more problematic. But probably things will change if, for instance, you collect your T cells very early in the course of the disease. And now also we know that CAR-T cells are moving earlier in the lines of therapies. So you can see it's a very complex equation with different parameters. I don't believe we have the right or wrong answer for this. And in addition, it's even more complex when you consider other targets, because we do have bispecific antibodies against other targets like GPRC5D, like FcRH5. There are also, although they're not commercially available, CAR-T cells against GPRC5D. You can also have dual CAR-T cells. And then you would imagine that in the landscape, putting all of these pieces of the puzzle together can be a little bit complicated. But I'm sure with the wider availability and the broader use of these agents, we will learn, and probably we will get a sort of idea what to do first and how to sequence them. I'm quite confident, because this is really a crucial question, because at the end of the day, it's about finding the right combination and sequence that would allow to prolong survival, but also to minimize the side effects and improve the quality of life of the patient. So I must confess, we have more questions than answers, but this is why it is a fascinating era.